What do you think of when you hear the word seizure?
You're having a problem. You're having an attack.
Able to take control.
Anyone else?
Absence.
Assurance.
Loss of control.
Seizures are when part of your body shakes.
Michael?
Electrical storm in the brain.
Alright, so this is a pretty good list to start.
Can I toss some confusion?
Confusion, sure. Yeah.
I'm good at that.
So sure, these are some of the things that we think about when we hear the word seizure, maybe. And I know that some of us in this setting might already know quite a bit about seizures. I'm sure some of you have had them before. Some of you probably have done your own research. And some of you might not know anything about seizures. I know for me, putting together this presentation and this project was as much for my own self-knowledge as it was me wanting to share and present what I found with all of you. Because I realized that there were a lot of things I didn't know about seizures and how they related to TBI and anything that might call into question. So that being said, I'm going to transition over here. A seizure is actually the result of a glitch or a malfunction in the brain's electrical system. So normally when your brain releases electric impulses, its energy is distributed in a very controlled way and it's used appropriately throughout the brain. But during a seizure, brain cells are kind of continuously firing, so it goes haywire a little bit. And epilepsy is a word for a diagnosis given to people. There are some other criteria and there's some disagreement about the diagnostic criteria for epilepsy, but typically it's someone who's experienced more than 2 or 3 unprovoked seizures and has an abnormal EEG reading. So there are lots of different types of seizures, and I'm not going to talk about them all in this presentation. Primarily, I'm going to focus on ones that fall into the first 2 categories, which are generalized seizures and partial seizures. But there are also things called gelastic and acristic seizures, non-epileptic seizures, which are things brought on by fever or ingesting certain chemicals or photosensitivity, things like that. And there's also something called status epilepticus. So now I'm going to play you a video clip about different types of seizures.
There are 2 main types of seizures, and they're based on the clinical presentation and what we see on the EEG. So the 2 big types are generalized seizures, where there's a big burst of electricity in the whole brain all at once. Under this category, there are generalized tonic-clonic seizures, which is what everybody thinks of as a seizure, so jerking stiff and then jerking afterwards. There are also atonic seizures, which are drops, where the person just loses tone and drops to the floor. There are myoclonic seizures, which are little quick jerks, and there are the classic absence, or what was called petit mal seizures, where the person stares themselves out for a few seconds.
And there's the seizures that come from one area of the brain called focal seizures, or the other word, partial seizures. Partial and focal really mean the same thing, where they start in one area of the brain and spread. Then we use that word complex. So complex partial seizures, which means your consciousness is sort of not there, versus simple seizures, which means your consciousness is not impaired. So a simple partial seizure Your arm could be just twitching a little bit, and I could be having a conversation with you right now, and I could be having a simple partial seizure. Or I could feel bugs or something weird in just one part of my body. That also could be a simple partial seizure. But if I look zoned out, spaced out, confused, then that's a complex seizure starting one area of the brain. Now, just because they start in one area of the brain doesn't mean they can't spread to the rest of the brain and become what you were discussing, a generalized seizure. But so it's important to differentiate where the EEG starts, what the symptoms look like, and how they spread.
And the reason for differentiating between those also is because it helps with treatment. Certain medications can only be used for partial seizures and get worse than generalized seizures. So, generalized seizures, the whole brain lights up at once. Partial or focal seizures, the discharges start in one discrete area of the brain. They may or may not spread. Complex partial seizures are associated with a change in the level of consciousness, so they're usually not totally with it and talking during it. And simple partial seizures start in one place and have no impairment of consciousness.
So, a question that people might have is, what do seizures look like? Well, as we just learned in that video clip about different types of seizures, they vary quite a bit in terms of what symptomology you're going to see. But some of the typical symptoms will include strange movement of your head, body, arms, legs, or eyes, like stiffening or shaking, unresponsiveness and staring. There's also quite often a sort of chewing or chomping movement that people will do with their mouth as if they're chewing food, and experiencing strange sensations of smell, sound, feeling, taste, or even visual images is fairly common. Sudden tiredness or dizziness, or not being able to speak or understand others very well. So this is a little animation I put together about what's happening in the brain when somebody has a seizure. So I'm going to use an analogy, and hopefully that'll help explain it. So imagine a man in the forest with a box of matches. Here's our forest. Here's our man with matches. So usually, if he's striking matches, they'll just fall to the ground and smolder and go out, and nothing will really happen. But sometimes, several matches can fall together and set the whole forest ablaze. And this is basically what's happening with the electrical circuitry of a person's brain during a seizure, is that there are a lot of electrical impulses that are kind of firing all at once and going everywhere in a non-controlled way. So, what are some of the causes of seizures? People often want to know what triggers a seizure. And there are several common triggers, although it kind of varies depending on person, and sometimes we don't really know what ends up triggering a seizure. But some of them may include ingesting certain chemicals or substances, photosensitivity, which is like bright flashing lights, strobe lights, for example, failure to take prescribed medications as directed, different hormone fluctuations, stress is a big one, or disturbed sleep patterns can contribute to the likelihood to have a seizure.
Maggie,
Yes,
dehydration is a big one too.
that's true. So, in terms of the timing of seizures, they're broken down into 4 different stages. There's the pre-ictal stage, which is what happens before a seizure. I'll talk about that here in a little bit. The ictal stage, which is during the seizure itself. Interictal stage, which is between seizures, if you have more than one. And the post-ictal stage, which is after. And the timing of each of these stages can vary quite a bit depending on circumstances and the type of seizure and individual just circumstances. So the pre-ictal stage, for example, not everyone has one. Sometimes they don't know if a seizure is coming, but for people who do experience this stage, they're able to use it as sort of a warning to be able to sense that a seizure is coming on. It can be as brief as a few minutes or as long as several days in some cases. So many people have something called an aura right before a seizure. That's part of the preictal stage. And technically an aura is actually another word for a simple partial seizure. So maybe a generalized seizure that affects the whole brain begins with a partial seizure that's just taking place in part of the brain at first. So this is a quote from the Epilepsy Foundation about auras. And they say, realistically, an aura might make you see, smell, hear, or taste something for no reason. It can even just make you a bit nauseous, give you a weird feeling in your stomach, cause a ringing in your ears, or even just give you a funny feeling or create a sense of deja vu. So you might be wondering,
what do you do if you find someone who's having a seizure? Number one, you want to stay calm. Assess the area, make sure that there's nothing that can cause injury to the person while they're having a seizure. You want to pay attention to the length of the seizure. You want to clear onlookers away. You don't want to clutter up the area with people looking and oogling and awing. You have to be sensitive to the person who's having the seizure as well. Don't put anything in the person's mouth. I know that's an old wives' tale to put a spoon or a wallet in their mouth. They will not swallow their tongue. They just need to ride out the seizure. You don't need to put anything in their mouth. It can cause more damage to shove something in there. You don't need to hold the person down. That can also cause more damage if you're fighting against them while they're shaking. Afterwards, you want to put them in the recovery position. Roll them over to their side. That way, if they start to vomit or any kind of saliva or any kind of fluids come out, it'll fall and they won't choke. So once they're recovered, you want to help them up, try to get them in a safe place. It may take them a while to fully get back to their normal self. If the seizure lasts for more than 5 minutes, you want to call 911. If the person suffering the seizure is pregnant or diabetic, you want to call 911. If it happens after a head blow or after ingesting any kind of poison or chemical, you want to call 911. If the person has another seizure within 24 hours, call 911. If the person is epileptic and has seizures often, they will wear a bracelet that says epileptic. This is part of their normal life. Be supportive, help them as much as you can, and be reassuring.
okay, so this again is just a text reminder for the things that we just learned in that video clip. Stay calm, clear objects, furniture, and people out of the way, loosen tight clothing, make sure the person doesn't fall and help them to the ground. Don't put anything in their mouth, but do turn them on their side once they stop jerking so they don't swallow any fluids. And don't try to hold them down or restrain them, but you may need to gently redirect them if they're like flailing a lot to prevent them from hitting or hurting themselves. And list of reminders of occasions when it's appropriate to call 911. So during the ictal phase, one of the things you might be wondering is, what do seizures feel like to people that are having them? Maybe some of you have had them before and know what yours feel like, but don't know what other types of seizures feel like, or maybe you have no idea. So during my research, I found a gentleman who has a YouTube channel dedicated to trying to find out more about different types of seizures, and he tries to film his own to help other people learn more about their seizures or their experiences with epilepsy. So we're going to watch just 2 clips from this documentary that he made. Before I start it, though, I will say the camera movements are a little bit jerky. It's definitely a homemade film, so I hope it doesn't end up being seizure-inducing. And we're going to watch, the first one is a complex partial seizure, and the second one is actually a generalized tonic-clonic seizure, or a grand mal. And that one, it's a little bit graphic, so just be prepared for that, and the camera movements are a little...
So what do you see? Tell me.
Alright, here's what I'm saying. This is wood and you step on it.
Okay, it's wood.
And there's
do you see?
Yes, hang on, I gotta go pee.
Do you?
Yes.
Okay.
You have to come with me because you have.
The camera.
No. What in the hell? Oh.
What about my hand? You're holding my hand. Okay. What do you see? Do you hear anything?
Oh.
He's holding my hand.
Oh.
Moderately.
Ow.
Okay. It's kind of tight.
Oh, whoa. Dude.
Yeah, dude. What do you see?
Dude.
Your hand?
Dude, please.
Without chunking. He's looking at his hand. He's still holding my wrist. What about your finger?
See it, Fran?
Yeah, what about it?
That's pretty.
Stress? Okay. How are you feeling?
Okay, so this is that second step. And the camera angles are really difficult at first, I apologize. But
And this one he bites his tongue, right?
yes. So, yeah, he bites his tongue during the seizure, so there'll be a little bit of blood. So try not to be alarmed. So she's trying to prevent him from hitting himself with his arms, but not restraining or holding him down.
As much as he's moving, all his muscles are tight.
Mm-hmm. Yeah.
Just tight.
Yeah. Most of things. Usually people are really tired. They're a little bit disoriented and confused. They might seem a little out of it and kind of not themselves for a little while. It's totally normal. It'll pass. And they might vomit or experience a loss of bowel or bladder control. Also totally normal. And it often helps people come back to consciousness if you ask them a single simple question to kind of help them reorient, like, what's your name, or do you know what year it is, or that kind of thing. One of the positive things about seizures, particularly epileptic seizures, well, I guess it's not positive about seizures, but there are medications that are available. And most of these drugs are classified as anti-epileptic drugs, or AEDs. And there are lots of different kinds. I won't go into all of that. But a lot of people who have seizures have one or several other conditions or diagnoses, like my client who has autism, Fragile X syndrome, and seizures I was talking about that has the absence seizures. Or sometimes they're associated with cerebral palsy or traumatic brain injury sometimes, depending. Stroke is another one that can be related. So all of these things come into play when doctors think about how to medicate someone or what the best choice of treatment is for people. There are also surgeries that are available for epilepsy. So it's always best to talk to your doctor about your particular conditions. But Chanel, one of the positive things is that since started making these videos, that gentleman that you saw having that really big seizure, he's started to understand his condition more and started to get on a medication track that helps him to not have seizures quite as often.
Well, that's good.
So these are some of the sources that I use. If you're interested in checking any of them out on your own, they're all accessible through the internet. Yeah, all of these are. So again, if you want a copy of the handout, I can certainly make one for you.
This book says stop. It won't stop. And then I started repeating myself, won't stop, won't stop. And finally I forced myself to let go, but then it continued, and I was kind of like in a semi-trance, it felt like, and I just kind of I think what I was trying to do was run away from it. I thought if I kept moving that it would go away, and I started walking circles around the kitchen island, and finally I was grabbed and taken over to the sofa and sat down and laid down, and I just kind of laid there for a while. And that was the first one, and I had a few more of those like that, and a few months later I was in the hospital, and I was getting some treatment there, and I was out in the hallway, and I just started getting this, I guess what was called an aura, and again all the lights seemed to get really dimmed, and that was a grand mal, or generalized seizures. Generalized because, it's, as I said, it starts in one area, then it just goes generally through the rest of the brain. And the only thing I remember about that was leaning up against the wall, sliding down, and the next thing I remember, I woke up in my bed, and again, I had blood on the pillow and in my mouth, and I got up and asked what had happened, and they said I'd had a grand mal seizure to go back to bed. And when I went back to bed, I woke up again in the morning, and I had more blood, and I asked them, well, what happened? They said, you had another one. I remember sleeping for a long time after that to recover from it. And I really didn't have a grand mal after that. I started basically having what the complex and the simple partials seizures, where one side would be active, and I wouldn't be able to respond to anybody, and I'd be a little bit wiped out for a while. I usually have to sleep, and it'd take a few days to recover. We tried all types of different medications up to maximum levels until they said, well, you just, you know. But yeah, that was that's what I recall about them. And the seizures I have now, and the good thing about it is that once you do learn about your seizures, like the guy in the video, once you learn more about yourself, how to care for yourself, learn what your symptoms are, and learn what triggers your seizures, then you can work to create a lifestyle that kind of minimizes the opportunities for those triggers, and so it lessens your opportunities for having seizures. Mine were based on overstimulation, fatigue, no sleep, poor diet, and stress. And the perfect storm would be if I was fatigued, stressed out, and I was in an overstimulating place, and that would determine how bad the seizure would be too. I haven't had a grand mal for quite a number of years. I'd probably say about at least 8 to 10 years I haven't had one. And so it has to do with the change of lifestyle. And I think, again, the perfect storm, I'm not going to ever say that it would never happen again, because if that perfect storm were to be there, then I have medication now that I can take, because none of the other medications worked. I was on such high levels that they took me off them because I was getting minimal results. But what they did was they gave me a medication to put under my tongue, and it kind of short circuits, it waters down the overstimulation of the electrical circuits. It kind of slows it down and helps me to cope better.
Is that medication dilating?
No, it's lorazepam.
There are lots of different types of medication.
All the ones that I did take, Larry, I was on such high doses and I was still having them that it would endanger my liver and kidney, so they took me off of them and said it's all going to be about you managing your lifestyle. It's scary.
Yeah, but I think you're doing a pretty good job from what I've seen.
Jeez, we're glad you're alive.
Me too.
I'm
But
glad you
everybody's
came
alive.
through them.
Well, we had one when we went to the ball game, and Maggie went to, I guess, our first outing. She was in the back seat there, and I think I remember saying, what, uh-oh?
You said something like, I feel a little tickle coming on, and
Something,
took the medication.
Oh.
Yeah.
I was going to ask if you would feel comfortable, would you talk to us about that experience and what you think might have contributed to having that seizure and what you remember about before and
I think I was probably stressed. I was probably fatigued. I had been sleeping well, and I thought going out to the ball game would be a relaxing thing, and something that would take the edge off everything, and it did. I enjoyed being at the ball game, but on the way back, I was in the corner in the back seat of the van, and there was a lot of talking going on, and I was trying to track all the conversations, and it became too much, and that's when I knew that I was going to have a problem, because I realized I'm not able to track the conversations anymore, and I just better leave the conversations alone and just kind of do like a quiet meditation. But it was too late, and I can feel the sensations coming on, the lips, the eyes blinking, and feeling like that helpless feeling. And I think I didn't even realize you were sitting next to me. I just said, I gave somebody a warning, like, uh-oh, here it comes, or I feel something coming on. And it wasn't a bad one.
No, it wasn't that bad.
It lasted about 3 minutes, but I was out of it conscious-wise. I remember that, and I remember getting out of the van at home. And I kind of liken it too, is I feel like I'm drunk, real drunk, after I've had them. Thought-wise, process, walking, the whole works. That's why I carry my card with me.
Yeah. And Michael, from what I remember, you weren't moving a whole lot. You might have been kind of twitching a little bit, but there was nothing particularly alarming about your behavior aside from the fact that you weren't incredibly responsive, but you were somewhat responsive. You were asked a couple of really direct questions that you were able to kind of respond to, and when Aaron or I or both of us asked if you were okay, you said, "I'm okay," several times. And that was really reassuring, I think, for everybody that was around you.
It was a quick tonic thing, and then it released. It was like a type of, like I was doing a deadlift or something, and then it released, and then after that was just all the aftermath going on.
So my last question to you, Michael, would be, what advice, if any, do you have for people who might witness seizures and not know what to do?
Just remember the advice that they had on the video. If I'm in the chair, if I can respond, ask me to get on the ground, or if I'm already know that it's going to happen, I will try to get on the ground. Just make sure I'm on the ground and I'm not around anything that I can hit, because I don't know how severe it'll be or how light it'll be. Just remind me to breathe, because I know sometimes when I have seizures I tend to hold my breath, and so just remind me to breathe. I may not be responsive, but in my brain I've got this kind of like little voice, somebody's trying to tell you something, do it. And I can sometimes respond to that, and so I'll try to breathe, but sometimes my body won't let me. But if I get the verbal instruction, my brain knows to try to respond to it, and so that helps. And if you ask me, just tell me you're going to be fine, you're doing okay, and just let me know how long, even how long it's left. This is only a couple minutes, you're going to be fine. that helps me to tell you later. You know, it's weird because there's some sort of process going on. I can process some stuff, and I think it's through learned repetition of having so many of them. But I can hear, and I give signals. I'll give you a thumbs up if I'm okay. If I give you a thumbs down, that usually means to call the medics.
There's other things that happen that are similar to seizures but aren't. And I have fibromyalgia, and one of the things that happens is what's called fibrofog. And I was having this experience the other day. I was trying to help someone with doing the newsletter.
Writing the minutes from the weekly meeting.
The weekly meeting. And I went there and sat down, and what I was asked to do was to read the notes that had been written. And I couldn't do it. It just didn't make any sense. I knew what I was supposed to do, but I couldn't. It just made no sense. But it wasn't a seizure. And it wasn't a seizure kind of thing. And partly because those types of events tend to last longer than seizures. Seizures are only usually last 3 to 5 minutes, kind of 5 minutes on the outside, or else it's something else. Or it's a recurring seizure or something. But I wasn't having a seizure then. I've had seizures that had similar symptoms, but they're just. So it's kind of a confusing area.
Do you think it could have been an absentee seizure?
No, I was perfectly aware. I know the seizures feel very different. I'm not worried. It just happens.